1, relax.
I don't feel like I don't feel the pain in every spot of the floor that I touch. I came because I had pain in my bottom of my foot, from the ball of my foot, beneath my toes that shot through my feet, and I had strain in my arches, like they were being strained, and they can't take impact like jumping or exercise or stepping down from a high curve. And I wanted to get foot surgery because my toes didn't fit into shoes properly. So I really wanted to get, surgery to alter my toes so that they better fit into the shoe, the standard shoe.
So for the past 2 visits that we've been working with, we haven't really done much for your foot other than just taking care of all the problems that are associated with your foot, like your hips, your low backs, and your upper back area. So would you be able to tell me exactly what the change has been for your foot pain that shoots from the ball of your foot to the tip of the toes?
It's lessened since I received treatment. I haven't really had any pain. Maybe for a little minute the other day I had some in my left foot, but I haven't had it as of recent.
But it's much less now though?
Yes.
Okay. Any kind of other changes you've been noticing? Because I know that we've been working with your overall body.
When I'm standing or waiting somewhere or online, my lower back doesn't give me the same cutting pain or nagging pain that I get in my lower back from standing still for a long time.
Okay, so you've been telling me that you have a pain from the ball of the foot right here to the tip of the toes, right?
Yeah, through here mostly, through the bottom.
Okay.
To the bottom and shoots together.
And then there was the pain. So when I touch here like this, how's the pain now? Still painful a little bit.
Yes, tender there.
So once again, it's actually something that actually takes some time to be able to get better. So it's going to be.
So tender.
This one is not as bad, but this one is a little bit painful. Gotcha. All right, so we'll go to compare with that afterwards. So as I have said before, that you do have what we like to call flat foot. So if I actually look at your foot here like this, you do notice that you don't really have a good arches. So that's one of the reasons why you're actually feeling a lot of pain right here. It's coming from what we like to call bone bruises. So that's actually something that is contributing to the pain that comes from the bottom of the foot to the tip of the toes right here. Okay. So I don't know if you recall we did this, but I'm going to go ahead and test the nerve strengthness of your individual toes. So go ahead and push up, please. So that tells me what's going on from knee and above. So let's just go ahead and do it just on the toe. You notice that there's a definite weakness on this side.
Again.
Okay. That's also weak again, right? Slightly stronger, but that was weak. Push up. That was weak on the 5th toe too. You notice all this, right? Yeah. Push down. So we do have some weaknesses on your 2nd, and then 3rd, and then some 5th toes. All right.
I don't know why my feet twist in.
Twist in as in like what?
Like this. They naturally sit like this.
Oh, that's also coming from the fact that you have a 1, flat foot, 2, because of the fact that how you are having your tailbone to be sitting, that's actually something that is really common. So I will also be able to kind of get into more to explain to you about that. Your muscles, I'm actually touching your muscles now, right? The muscles are just so tense and so overly exhausted.
I get tight shins as
exactly.
soon as I exercise. So
that's actually something that comes with a flat foot. Yeah, that's also contributing to your pain right here. So I know that we've been working with your foot here before, but something that we'll be working on today. Okay. Just go ahead and walk for me, please. Pain on the ball of your foot. Okay, just walk for me one more time. We'll see what we can do. The low back pain that I actually see right here is actually coming from right about here. How's the pain when I actually press down right? This is the one that you've been feeling, yes?
Yeah.
Okay. You also had problems that are coming from your mid-back area.
This feels right here like you could crack it 3 more times.
Okay, I'll go take a look at that a little bit. But let me go ahead and fix exactly, let me try to find the problems exactly where you have problems on your, right here I actually found the problem. Slightly more forward, please. How are you doing? You doing okay?
Yeah, I'm good.
Okay, relax. Here we go. Go ahead and then contact right here. You see all this pain right here that you notice is coming from the muscle spasm. So this is what I want you to do. I'm going to go ahead and have your foot right here. Okay, and then push it up and inward as I say so, okay? I'm gonna go ahead and make a good contact here first now. You already feel it, don't you? Let's try it one more time. Push it in, inward, stay, and relax. Push it out. Inward.
I feel it in my neck.
Yes. You feel in the toes because the muscles play a very big role in your case. Push it up and inward. Count to 5, 4, 3, 2, 1. Relax.
Oh. Sometimes you don't know how tense you are. You don't know what's going on sometimes until somebody touch you.
Exactly. Well, that's the reason why you come to see a doctor, right? To get you better. Push it up. Maybe I'll do one more pass over here. Push it up, inward. Good. Push it up, inward. Good. Push it up, inward. Good. Okay, let me just go ahead and see exactly what I have done for you today. So if I have done my job properly, you are going to be noticing some improvements on some of the muscle functions of your toes. So I'm gonna go ahead and ask you to push up. That's strong now. Push up, stronger. That's about what we said.
That's a weak toe.
Yeah, that was supposed to be the weak toe, but you're actually pushing it up now, right? Push it up with the that's strong too. Fourth toe, strong. You couldn't do that before. Push it up. Okay, you still have flat foot. You still have the portion of the pain on the ball of your foot coming from the fact that you've been abusing your foot because you have lost the arches. And the pain could be coming from over here. I'm going to be touching the ball of your feet, which was really tender before I started working on you today. We'll see exactly what the differences are, okay?
It just tickles now.
It doesn't hurt, right?
No, it just tickles more now.
I'm going to go ahead and do a little more, but even that, it doesn't hurt, it just tickles now.
It tickles, yeah.
I didn't touch your foot. I didn't even touch your foot, but your foot pain is gone. What that tells me is that your major problem still is your tailbone area that we've been working with. That's the reason why you're having so much pain on this area. Not because of the fact that you have less surgery. I know this kind of is ticklish for you, but you understand now the differences? It's actually different. Your problem right here, the pain right here, from shooting from ball of the feet to the tip of the toes, tailbone.
Tailbone, okay.
You are actually walking a lot faster too. Do you notice that?
Yeah.
What's the difference?
I don't feel I don't feel the pain in every spot of the floor that I touch. I don't feel like I have a lot of impact of the floor as much as before.
Good. Hi, this is Dr. Lee. Leftist before and rightist after. Let's try to compare those two. Before the treatment, notice how she's drifting to one side as opposed to the other. This is due to the fact that she got a dysfunctions going on in her low back and also in her tailbone area. This is also due to the fact that she has a flat foot pulling her feet into different directions. After treatment, notice how she has one direction as she's walking. Notice also she has wider strides and a wider stance as she's walking. She's able to put down her foot harder because there is less pain in her foot. Here you can definitely see the differences between the before and after treatment and then the walking directions. We are going to work on her tailbone and her low back areas to improve her foot functions, and we'll also directly address her flat foot concerns. Thank you very much for watching.